Good afternoon to all the esteemed faculty members. I'm Dr. Rajeshri Singh, and today I'm presenting on behalf of Dr. Parmeet Singh, who's busy with his MS final exams. Our work is a comparison of comprehensive glaucoma quality of life 16 questionnaire with the National Eye Institute Visual Function Questionnaire 25 and the Glaucoma Quality of Life 15 questionnaire to evaluate the quality of life in glaucoma patients. To begin with, glaucoma is the second leading cause of blindness. It affects every 8th individual who's aged more than 40 years of age, and the numbers are expected to rise to 111.8 million by 2040 worldwide. It is the severity and the duration of the patient's visual impairment from glaucoma which restricts their capacity for independent living and lowers their overall quality of life. Therefore, a variety of surveys and questionnaires have been developed to assess glaucoma-affected individuals' quality of life, each having their own strengths and their own limitations. As for the existing questionnaires, we have the NEIVFQ 25, we have the GQL 15, we have the Vishwanathan 10 questionnaire, and we have the COMTEL questionnaire. The NEIVFQ 25 questionnaire is not glaucoma specific. Also, it does not measure the treatment-related outcomes. GQL 15, on the other hand, though glaucoma specific, does not assess the general health quotient and the psychological aftermath of the disease. Same goes for the Vishwanathan 10 questionnaire. And the COMTEL questionnaire has only been applied for the timolol and pilocarpine. Therefore, there was a need to develop another questionnaire which measures not just the general health, but is also glaucoma specific and also measures the psychological aftermath of the disease. We therefore came up with the comprehensive glaucoma quality of life 16 questionnaire, which comprised of 8 domains and 16 questions in total. The scores were 0 being never, sometimes being 1, and always being 2. The higher the score meant the poorer quality of life and more severe disease. As for the methodology, it was a cross-sectional study which was done over the course of 2 years, involved 140 patients which were equally divided in the POAG and the PACG group. For the inclusion criteria, it involved patients who were aged more than 40 years or were of either gender and were on medical therapy. As for the exclusion criteria, patients with visually significant cataract, diabetic retinopathy, hypertensive retinopathy, ARMD, prior glaucoma, cataract surgery, and any systemic medical conditions were excluded. For the QOL questionnaire delivery, firstly, the CGQL 16 questionnaire was validated for the internal consistency, the construct validity, and the conduct validity. Each participant completed all the 3 quality of life questionnaires. The questionnaires were administered by the same interviewer on 2 visits, 1 week apart, to ensure consistency and minimal recall bias. As for the baseline parameters, the mean age was 58.47 years, with the maximum number of patients being in the 51 to 60 year category. There was slight male preponderance, with 80 patients being male and 60 female, and the patients were equally divided in the PACG and the POAG group. As for the results, the correlation coefficient rho was measured, which showed, which if -1 showed strong negative correlation, 0 being no correlation and +1 being positive correlation. We saw that for the CGQL 16 and NEIVFQ 25, we saw a strong inverse correlation, whereas for the CGQL 16 versus GQL 15, we saw a strong positive correlation. The same being depicted in the graphs below. So, the NEIVFQ and 25 and GQL 15 lagged in not assessing the non-visual domains, whereas the CGQL 16 included the visual, non-visual domains, including visual disability, psychological burden, and the social limitations. Also, it was the concise format of the CGQL 16 allowed for its completion in under 5 minutes. Limitations of the study, however, were that it being a single center study, the results may not be generalized. Also, the study has a limited scope because it did not include the secondary glaucoma types. To conclude, CGQL 16 is a concise, valid, and efficient patient tool for assessing quality of life in glaucoma patients. Thank you.
Dr. Rashmi, this your question is wonderful. But one thing is this all depends on the psychological and the lifestyle of the patient. Because I know when I was in Nigeria, the patients of glaucoma in Nigeria behave in the other way. They are extrovert. So this questionnaire should be dealt in the detail.